My name is Emily Marcinkowski, and I'm a surgical oncologist here at the Markey Cancer Center. So I specialize in breast cancer as well as soft tissue sarcomas and skin cancers. So my mother was a scrub nurse, so I kind of grew up going to the operating room or kind of being there whenever she was on call. I was on call. So spent a lot of time up at the hospital, and really liked surgery because you can really help people and kind of fix a problem. I like the relationship that surgeons have with people. It tends to be a little bit more of an intimate relationship than some other areas in medicine. People are very vulnerable whenever they come in, and you get to develop a relationship with them and truly get a pretty tight patient-doctor relationship. I really like to listen to the patient, listen to what their goals are. People have very different opinions, or women have very different opinions about their breasts. Some women really want to keep their breasts, some women want to have their breasts removed, some women, their goal is to come in and get their therapy and get on with their lives. It's very different for each patient, and I think just sitting back and listening to their stories, some patients have a very strong family history of cancer, and because of that, it frightens them very much. I think the multidisciplinary aspect here is very good. The tumor boards that we offer, we're having these tumor boards once or twice a week, depending on the modality or the disease process that we're treating. And because of that, I think that we're able to get patients in faster, we're able to get their treatment started faster. I think that bringing patients here, they can see the medical oncologist and the surgeon the same day. They really can come in not knowing anything about their diagnosis and then kind of know their entire treatment plan by the time that they leave. And that is, especially for these patients that are coming from 3-4 hours away, is a really big deal. Each patient is an individual. Each patient has a different goal in mind whenever they come in, especially for breast surgery. Some patients want to keep their breasts, some patients want to have their breasts removed, some patients want to have reconstruction. Those are all moving parts that have to work well together. And some patients need chemotherapy up front, some patients need it after surgery. So making those decisions together in a tumor board type setting or a multidisciplinary type setting is very important for each patient because it allows us to give them individualized, personalized care.